Healing Hospital Multi Super Specialty near Nehru Stadium, Bidar.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ألم تر كيف فعل ربك بأصحاب الفيل ألم يجعل كيدهم في تضليل وأرسل عليهم طيرا أبابيل ترميهم بحجارة من سجيل فجعلهم كعصف مأكول صدق الله العظيم.
السلام علیکم ناظرین، ناز میڈیا میں آپ کا استقبال ہے۔ آئیے دیکھتے ہیں اہم خبر۔
فوج کی بحالی کے میدان میں ایک اہم پیش رفت سامنے آئی ہے، جہاں بیدر میں ایک روزہ عملی ورکشاپ کا کامیاب انعقاد عمل میں آیا۔ فزیولوجک اکیڈمی نے باؤنس بیک فزیوتھراپی سینٹر گلبرگہ کے اشتراک سے اور سید بارے ایجوکیشنل اینڈ چیریٹیبل ٹرسٹ گلبرگہ کی سرپرستی میں فالج یعنی سٹروک کی بحالی پر ایک جامع اور تصدیق شدہ ورکشاپ منعقد کی۔ اس اہم پروگرام کا آغاز تلاوت کلام پاک سے کیا گیا، جس کے بعد پودے کو پانی دے کر تقریب کا باضابطہ افتتاح عمل میں آیا۔ اس اہم پروگرام میں گلبرگہ کی معروف، جانی مانی اور باوقار شخصیت، ممتاز فزیوتھراپی ماہر ڈاکٹر محمد انوراللہ خان کی شرکت اور رہنمائی خصوصی طور پر مرکز توجہ رہی۔ ڈاکٹر انوراللہ خان نہ صرف ایک ماہر معالج ہیں، بلکہ علمی و تدریسی میدان میں بھی نمایاں مقام رکھتے ہیں، اور اس وقت SASSB کالج آف فزیوتھراپی گلبرگہ میں پروفیسر و نائب پرنسپل کے عہدے پر فائز ہیں، جبکہ باؤنس بیک فزیوتھراپی سینٹر کے ڈائریکٹر کے طور پر بھی خدمات انجام دے رہے ہیں۔ ورکشاپ کے دوران ڈاکٹر محمد انوراللہ خان نے تفصیلی خطاب کرتے ہوئے فالج کی وجوہات، اقسام، ابتدائی علامات اور اس کے بعد پیدا ہونے والی جسمانی و اعصابی پیچیدگیوں پر جامع انداز میں روشنی ڈالی۔ انہوں نے اس بات پر زور دیا کہ فالج کے مریضوں کے لیے بروقت طبی امداد اور مسلسل فزیوتھراپی نہایت اہم ہے، جو مریض کی زندگی کو بہتر بنانے میں کلیدی کردار ادا کرتی ہے۔ اس موقع پر شرکاء کو عملی تربیت بھی فراہم کی گئی، جس میں نیورو ڈیولپمنٹل ٹریٹمنٹ یعنی NDT طریقہ کار اور جدید تکنیکوں کے ذریعے اعصابی و عضلاتی ہم آہنگی کو بہتر بنانے کے طریقے سکھائے گئے۔ ڈاکٹر انوراللہ خان کی عملی رہنمائی نے طلباء اور معالجین کو جدید طریقہ علاج سمجھنے میں اہم مدد فراہم کی۔ اس پروگرام کے انعقاد میں SASSB کالج آف فزیوتھراپی گلبرگہ، سن رائز کالج آف فزیوتھراپی بیدر اور MS کالج آف فزیوتھراپی بیدر نے بھرپور تعاون فراہم کیا، جبکہ ورکشاپ ڈاکٹر محمود بن طیب کی نگرانی میں نہایت منظم انداز میں منعقد ہوئی۔ یہ ورکشاپ 18 اپریل کو صبح 9:30 سے شام 5 بجے تک سن رائز کالج آف فزیوتھراپی بیدر میں منعقد ہوئی، جس میں طلباء، فزیوتھراپسٹس اور طبی ماہرین نے بڑی تعداد میں شرکت کی۔ منتظمین کے مطابق اس طرح کی ورکشاپس کا بنیادی مقصد طبی ماہرین کی پیشہ ورانہ صلاحیتوں میں اضافہ کرنا، جدید طریقہ علاج سے روشناس کرانا اور فالج جیسی سنگین بیماری کے بارے میں عوام میں شعور بیدار کرنا ہے، تاکہ بروقت علاج کے ذریعے مریضوں کی زندگی کے معیار کو بہتر بنایا جا سکے۔
Afternoon, Secretary Aditya. Myself, from SSSB College of Physiotherapy, Gulbarga. I came to Bidar for the workshop of stroke rehabilitation. It was a nice workshop which was conducted by Dr. Anwarullah Khan sir, and in collaboration with Physiologic Academy and MS College of Physiotherapy. So the workshop was very nice, and we have done stroke rehabilitation. And sir has taught many techniques and mnemonics for the some practice for the upcoming practices. For the workshop was very good, and it was great to have knowledge and such a good speaker in this workshop. Thank you.
Like to the medical treatment will be to prevent the further damage. जब किसी इंसान को स्ट्रोक होता है तो जब हॉस्पिटल में एडमिट करते हैं तो वो हॉस्पिटल में मेडिकेशंस का काम क्या है कि उसको और डैमेज होने से रोकना, लेकिन जो डैमेज हो चुका उसको वापस कैसे निकालें, तो उसको वापस लाने की जिम्मेदारी है हमारे प्रोफेशन की, जो है फिजियोथेरेपी। So the role of a physiotherapist in a stroke is 80% of physiotherapy treatment and 20% is the medical treatment. That's where we play a very major role, especially in the stroke cases. And majority of patients are getting stroke. So that is why today we are having a very well experienced instructor, Dr. Anwarullah Khan sir, and he did his PhD graduation in the year 1996 from Bidar College of Physiotherapy, Bangalore, and sir has did MPT in Neuro from Ninte Institute of Physiotherapy, Bangalore, and presently he is pursuing PhD in Neuro in Udaipur. And Anwarullah Khan sir worked in Ministry of Health in Saudi Arabia in Makkah for 12 years, where he had given his services especially in the sports rehab as well as in the neuro rehabilitation. And sir presently working as a vice principal and a professor in Sayyid Abu Bakr Siddiq Sayyid Wale College of Physiotherapy, Kolkata. So we welcome you here sir today to share your experience and insight to our young physios, inshallah. So today definitely you will learn a lot. But now, as it's very late, so we will start our workshop by a beautiful recitation from Zufisha, the recitation of Quran.
Assalamu alaikum warahmatullahi wabarakatuh. Very good evening. This is Dr.Mohammed, Principal Sayyid Abu Bakr Siddiq Sayyid Wale College of Physiotherapy, Kolkata, the founder of Physiotherapy Academy. Today in Bidar, we have conducted a workshop regarding the understanding of stroke, and we are very grateful. Because we have collaborated with the Sunrise College of Physiotherapy and MS College of Physiotherapy, the Bidar, with their collaborations and with their support. We have conducted a very good workshop. And we have today we have conducted this workshop with our great instructor, the professor of SSB College of Physiotherapy and the director of Bounce Back Physiotherapy Clinic, Dr.Mohammed Anwarullah Khan sir. And he is having around 15 years of experience in neurological physiotherapy rehabilitation. And the main motive of this conducting workshop with Bidar is to give awareness regarding the physiotherapy profession and between the physiotherapy student, so that they can be able to learn a lot of advanced physiotherapy techniques. And it has to be give a lot of awareness in regarding the physiotherapy profession, because we have many colleges that have been opened in Gulbarga and Hyderabad and bigger region. So we are very grateful here in Karnataka state that we are having a lot of medical colleges, and that's why we need a lot of awareness, because after PUC there are many options in the science field. Like everybody, they are only take option for MBBS, but as soon as there are many options in medical field, so physiotherapy is also one of the option, in which we are having 5 years of course, and we will get the doctorate degree. So it's having a lot of scope, not only in India but also in the globally. So with this motive, we have started by conducting the workshops to give awareness in between the people of Karnataka, especially in the region of Gulbarga, Bidar and Hyderabad region, as well as it is giving a good insight and good knowledge to improve the skills of the physiotherapy students who are already studying a physiotherapy, so that they will have a good advancement and they can do a lot of better in the future. Thank you so much.
Professor of Sayyid Mohammed Sayyid College of Physiotherapy, and very thankful to MS College of Physiotherapy and Sunrise College of Physiotherapy about stroke rehabilitation in their college, their premises, for the benefit of the students. As they are came from our college also, And it was a very good and very good actually atmosphere for the students who were taking it investment and very cooperative in learning and they were very involved in the practical sessions also.
Good morning, everybody. It's almost afternoon now. So, hope everybody might be knowing about stroke. Can you say anything about stroke? What do you mean by stroke? As I've given the topic, understanding the stroke, we are going to cover today here about the contents in definition, epidemiology, the risk factors, the prevention, warning signs, clinical symptoms, synergy, diagnosis, and PT management. This will be our first part. In our second part, after lunch, we are going to focus on PNF technique. Later on, after that, we'll have a tea break. Then we'll go for BOBA technique. We'll try to cover as much as possible. And more important, I want this lecture to be an understanding for you all. It has to be a two-way lecture. So that it is like you already know about stroke. Something like, what do you mean by stroke? Anybody knows? Can anybody say what do you mean by stroke? Yes, madam. Rupturing of the blood vessels. Any other one? Blockage of the blood supply. Okay, ठीक है. Well, we'll start with the definition of the stroke. Mainly with the concept, whenever any patient we see who is walking from paralysis of one side of the body, we say it's stroke. But it is not stroke. Right? It is a clinical representation, what you call it as hemiplegia. In this clinical representation, we have monoplegia. It is like paralysis of one part or one leg, one arm. Paraplegia is paralysis of both the lower limbs. Diplegia, hemiplegia is paralysis of one side of the body, either right or left. Quadriplegia is paralysis of both the upper limbs as well as both the lower limbs. Pentaplegia is paralysis of respiratory muscles along with the core limbs. As the definition starts with from the WHO, World Health Organization defines stroke as a rapidly developed clinical signs of the focal disturbances of cerebral functions lasting more than 24 hours or leading to death with no apparent cause other than the vascular origin. The most important part in the definition is vascular origin. Most important part in the definition is symptom lasting for more than 24 hours arising from the vascular origin or sometimes may lead to death. This is called as stroke. there is one more symptom that is called as transient ischemic attack. The symptoms which resolves within 24 hours. It is called as transient ischemic attack. That is TIA. If a person who is walking with hemiplegic side with upper motor neuron type of lesion, he might be having a head injury or a space occupied lesion that is called as tumor. But in stroke, most important, repeatedly I am saying, most important, it has to be a vascular lesion. A tumor patient is having paralysis one side body, he is not stroke. It has to be, that is very clear, that is the clinical representation. Many times we see the person or the student when we see what is stroke, paralysis of one side of the body is stroke. No, that is clinical representation. The source of the hemiplegia which is coming through vascular origin, that is stroke, and the symptoms should last more than 24 hours or sometimes may lead to death. If the symptom resolved within 24 hours, it is called as TIA, transient ischemic attack. Understood? So that if you understand the definition, then only we can proceed. It is not a paralysis of one side of the body. It is a vascular supply which is getting interrupted because of vascular origin. Epidemiology of stroke, as sir has said, the leading cause. The third leading cause of death. Throughout the world it is, these statistics I have taken from community medicine, preventive medicine textbook. So third leading cause of death, stroke related death every 3.3 minutes. A new stroke every 43 seconds. The leading cause for long-term disability in the elderly. The leading cause of long-term disability. A patient, according to our definition, on the first slide only, the patient will die at that time only. Or he might be in a disability. Patient will live for longer time. Patient long time and they die because of the secondary complications of stroke. That is their due to increases spasticity, because of their bladder and bowel incontinence, because they of respiratory complications, because of their pressure source. These are the reasons they will be there on the long-term disability. The incidence of stroke increased dramatically with the age, doubling every decade after 55 years. The incidence of stroke is about 19% higher in males than females. Can you say why? Why the males are more prone for stroke as compared to females? Accident नहीं है, trauma नहीं है. Vascular origin, we are coming from vascular origin. So later on we'll come to know. Okay? Later on in coming slides we'll come to know why males are more prone for the stroke as compared to females. Epidemiology continue. Ischemic stroke. There are two types of stroke. One is ischemic stroke, another is hemorrhagic stroke. Ischemic stroke lasts up to 80%. Most of the strokes are ischemic. Then that is cerebral thrombus or cerebral emboli. The emboli is from hemorrhagic stroke is of two types. That is intracerebral or subarachnoid hemorrhage. So ischemic stroke, we will explain about this, how the ischemic stroke is happening. Ischemic stroke is when there is decreased blood supply to the brain that cause hypoxic damage to the brain. Hypoxic damage is decreased blood circulation to the brain or decreased oxygen supply to the brain. That is narrowing. That it is slowly it is going to progress. In thrombus, what will happen? There is accumulation of the atherosclerosis, inflammation of the arteries, which is going to accumulate through the fat, okay, cholesterol, fat and all. Then there will be rupture. I will show the video also. There will be rupture of the artery. Then that will make a clot. That clot is going to block. That will cause a thrombus, right? Then that is our hemorrhagic. In hemorrhagic, there are many types of hemorrhagic strokes. That is especially when we see hemorrhage is rupture. Hemorrhage is rupture of an artery that will cause a bleeding inside the intracranial blood. Then there will be decreased blood supply to the brain and there will be hypoxic brain damage. and there is a one मजे की बात जैसे होता है, there is a collateral circulation, collateral development. There is when there is artery block, when this artery is blocked, suddenly the connection will be, this is anterior communicating artery, this is anterior cerebral artery, and this is anterior communicating artery. This is called as aneurysm. What is aneurysm? A sac-like or pouch-like structure in the artery due to increased blood pressure that will develop a aneurysm. When a person is having any pressure or tension, there will be rupture of the aneurysm that might lead to hemorrhagic blood, hemorrhagic stroke. This is more common aneurysm which is causing a reverse pressure. This is causing aneurysm on the anterior communicating artery of the brain. This is causing decreased blood supply to the anterior surface. That will cause reverse pressure of the blood supply. That will create a aneurysm. Aneurysms are sometimes congenital also. I might be having, you might be having. Sometimes when the blood pressure increases or when we are in stress, that time my artery might rupture. So this is it. This is the way you are going to diagnose, and later on we come to know this is aneurysm. And because of this aneurysm, there will be rupture in the artery that will lead to hemorrhagic stroke.
It is one of the leading causes of disability and death because stroke is the result of permanent damage of the brain due to inadequate blood flow and loss of oxygen supply. This may be caused by blockage or rupture of a blood vessel inside the brain. The part of the brain which is damaged can
ऐसे ही मजीद वीडियोस को देखने के लिए हमारे चैनल नाज मीडिया को सब्सक्राइब करें और वीडियो को लाइक जरूर करें।